That is why I kind of wanted to talk to you because, I actually only got through chapter 4 of your book. So you're going to have to fill me in on your solutions part. But honestly, this book, Listening for What Matters, it was a real eye opener for kind of, the a lot of the loopholes in the gray area in our healthcare system, and it really gave I mean, honestly, folks, I recommend picking it up because it really gives you a practical knowledge on why certain things are so why the system itself is so wasteful in general, and a lot of where that waste goes.
Yeah, well, it's been a really interesting journey for me. I'm not a physician myself, but my colleague Saul Wiener, who wrote the book with me, and is also a health services researcher. And that's just, I mean, I can't wait to talk about that project because it's just been so very interesting to me too.
Yeah, absolutely. So let me ask you, when you were kind of putting this project together, how long did it take you guys to actually get all the results?
Well, we started working on the problem maybe 15 years ago, and the problem was so Saul, as I said, is a doctor, and so he's training doctors, and he had a bunch of residents who would go in and see patients, and they'd come out and they'd talk about the patient to him that they saw, and he realized when he went in and talked to the patient that the resident had gotten all the medical stuff right, but they'd missed the fact that this patient was now driving trucks at night, and so his insulin would freeze, or this patient had lost his health insurance, and so prescribing that more expensive drug wasn't going to get filled.
Right.
And he began to realize that we have a problem. We're really good at understanding the science and what you should do for the average person, but we have a real problem figuring out how people are different than the average person and what you need to do to make care work for that person.
Right. So it's more about kind of bringing a whole understanding to the care of the individual, looking at certain, life influences, I mean, finances, family life. Those are influences as much as, any physical health, or those are influences on physical health as much as the actual biology of the person. And I mean, I guess coming from a psychology background, that kind of helped you kind of look into this because, psychology, they teach you that you need to look at the whole situation and all of their influences on a person's life.
Yeah, so that's part of it. The other part of it is that my area of psychology is actually pretty experimental. I used to say that my job was to run people through mazes, and that turned out to be really important because when Saul came to me, he said, "I've noticed this thing, and let's think about how we could actually study it in doctors." And I naturally thought, well, how could we do some experiments where we control the situation and find out what doctors would do? And that's where we had this idea of basically doing secret shoppers to doctors' visits, training actors to pretend to be patients where we could control what was wrong with them in a kind of experimental fashion and sending them into doctors who thought they were patients and
Mm-hmm.
seeing what they did.
And so let me ask you, over the course of the experiment, how many different actors did you get involved in this?
Oh, I mean, in the first study, there were, I think, 8 or 10 actors, but we've since done many additional studies. I'm sure we've worked now with, I don't know, 80 different actors maybe in 5 or 6 states.
Okay, so let me ask you, does this I mean, I guess does this issue does it vary state by state to the point that you can tell where there's less healthcare infrastructure, there's a noticeable difference, or is it centered in more like urban areas, or is there a differential, I guess, between rural and urban?
Yeah, that's a really good question. I mean, we haven't, I think, done projects that have really looked at that well enough. We've done work in the kind of Chicago and Wisconsin area, which is mostly urban, suburban. We did a big project in New Jersey where it was sort of spread all over the state, but there weren't enough, I think, kind of suburban or rural practices to really make that comparison.
Mm-hmm.
But it would make sense, right? Because when you think about the context of people's lives. What you do in your life is different if you, live in the city than if you live in the suburbs, than if you, work on a farm or the feed store. That would be totally relevant.
So I guess looking at your research, when you were trying to get different types of context, and what was some of the most what are some of the most common types of contextual understanding that doctors kind of missed? I mean, was there
Mm-hmm.
was certain specific life influences that they should have been asking about, or was it just more emotional perceptions of things?
Yeah, we came up with like 12 different kinds of context, and the pattern of which mattered most would really depend on where you were. So we did a lot of work in the VA healthcare system, doctors taking care of veterans. And, veterans have different sets of problems in many cases, the ones in the VA system, than your folks who are going to, a private practice in the city, or your folks who are going to Cook County Hospital. They're all a little different. But really common is not thinking about financial issues, not thinking about access issues like transportation,
Hmm.
and not thinking about competing responsibilities. Like most people, if they have to make a choice between taking care of themselves and taking care of their kid, choose to take care of their kid. And if you don't know that about them, then some of their behavior when you're trying to take care of them doesn't really seem to make sense. Why are they not doing what you're saying? Why are they, making these choices and not those choices? But once you realize there's other thing going on in their lives that is totally justifiable and is important, then you begin to be able to say, well, what could we do to take care of you that doesn't get in the way of you taking care of your kid?
Right. Huh. Well, I mean, and there's so much crossover there as well because, if someone has financial issues and they're working, 2, 3 jobs and, they may only have,
Yeah,
health insurance through one of them. I mean, they can't always make those doctor's appointments, right? I mean, because most doctors, if you're, working and, if you're having appointments, usually like I'd say between 9 to 8 o'clock, if someone's working 2 jobs, that's just not doable. And sometimes you may only
yep.
have one, day off a week, if that.
Exactly. So, if you were to do this kind of research in other countries, you'd find probably different kinds of contextual issues, but you wouldn't necessarily find the financial one, right? Because there are a lot of places where everybody has health care, where they
Right.
arrange to, have access to doctor's visits on Saturdays and things like that. But, here, that's a kind of thing we've got to figure out.
So I guess how does the contextual issues I guess kind of hold our healthcare system back from being more competitive with those other countries that are over the pond or systems that are over the pond.
Yeah, well, I mean, I think some of that is just that, we know we want to take care of people. We want people to get healthy. When people get healthy, it tends to be cheaper for the healthcare system, right? And also, when doctors miss patient context, what typically happens is it means they have trouble explaining what's going on. And so the natural recourse in the US is you order a lot of tests,
Right.
right? Which then adds cost to the healthcare system, and the tests don't come back, showing anything useful, and so on. I mean, in our first study, one of the cases was a guy, an older man who was like losing weight, and the actor gave sort of several cues that, if they'd been followed up on, might have suggested that the reason why he was losing weight was because he didn't have enough to eat. And doctors who followed that up, and the actor would say, yeah, actually, I lost my job and now I can't, get food. They'd be able to help that person, and it wouldn't be much of a cost to the healthcare system because they'd be connecting them with a food pantry and stuff like
Right.
that. The docs that didn't get that, their immediate thought was unexplained weight loss, probably what kind of cancer, because he has no other symptoms. So we need to do the full malignancy workup, right? This guy's got to get a colonoscopy, and he's got to get an endoscopy, and he's got to get like all these tests, right, that are going to rack up costs, assuming he even goes to them. And if he does, they're going to all be negative, right?
Yeah.
And that's a big problem.
Wow. That I mean, just that alone, like, having worked at an insurance company myself, I just automatically had flashes, $100,000 in tests just coming through. And because you see that on these claims, all the time. And, it
Yep.
seems, I don't know, it seems strange that that is such a simple question to ask someone, are you getting enough to eat? Are you getting enough nutritional value throughout your day? I mean, I get, asking that
Right.
kind of question can be uncomfortable. And a lot of folks, like, if that is, your legitimate issue, like, with there's a cultural stigma that comes along with, not being able to have enough in
Sure.
this country, right? People get embarrassed about, asking for help or, expressing those things. And I get it.
For
But
sure.
yeah, it's that one in particular just seems like such a simple question that you could ask someone. I mean, why don't you think doctors take that initiative?
It's really hard to be a doctor, right? And if you think about some of the other pressures in our healthcare system, I don't know what your last visit was like, but doctor's visits are usually like 15 minutes these days.
Oh, easy.
And right, and they've got a computer in front of them, and they've got to talk to that computer as much as they've got to talk to you, right? So they're because that computer, which is supposed to be like your medical record, is also the way we do billing. So they've got to check all the boxes and do all the things that are necessary, or the visit doesn't get billed properly and they don't get paid. Right? In other countries where they don't deal with healthcare billing, the medical record is really a record about the patient. In the U.S., it's both a record about the patient and a record of what the claims for insurance should be.
Right.
So the doctors are having to task switch all the time. So one of the things that we know is actually you can be very efficient in a 15-minute visit, but it's really hard to be efficient in a 15-minute visit if you're spending most of your time with the computer and not with the patient. It's also difficult because you tell doctors about this, and usually the first reaction is, well, what you're saying is this is individual patient context, which means it could be anything, right? There's a million things that we could ask about. How do we know what to ask? Because if we asked everything, we'd be in that visit for hours and hours and hours. And what we say
Right.
is, well, it's not that everything matters. It's that the patient will often tell you, right? They don't know what matters because they're not a doctor, but they will tell you what's going on with them and what they think might be important for you to know. And if you're listening to that and you're asking about it, actively asking about it, the things that you think might relate to their health care or how they're feeling, it doesn't actually require you to ask a zillion questions. When a person says something about, having trouble getting food, that's something you should ask about.
Yeah, it seems that I don't know, almost that they don't know what to ask about or what could be pertinent to it because of the kind of the boundaries of that situation. Because I mean, primarily if you're a doctor, we were talking about those 15-minute meetings. I mean,
Mm-hmm.
they try and crank out as many appointments as they can per day, and just I mean, if you look at it from that billing perspective, right? If you're cranking out these appointments and they're trying to crank out those claims as fast as possible, a lot of those are going to be appealed, sent back, misdiagnosed with like procedure codes, and now you're talking about how much additional administrative cost that is added on to that. I mean, I feel like if you have that centered approach, if you kind of take that time, that I don't know, it's going to cut down on the administrative costs overall. But I mean, how do you kind of address that? Do we just need more doctors?
Yeah, it's a good question. I mean, some places we certainly need more doctors. I mean, we think we need to train doctors differently. We need to help doctors pay attention to this and to make it kind of a norm that if you hear something that your patient says that you're curious about, it really is worth asking about it a lot of the time. The study we did in New Jersey, we spun off a company to do this outside of our research.
Right.
We did this study in New Jersey. And in that study, we found that for certain kinds of conditions, like everybody is really perfectly aligned. You can make people healthier and also save money in the healthcare system. So an example of that is if you figure out why people who have diabetes aren't dosing their insulin properly, and you fix that, then you save a lot of money because those people don't end up in the hospital. And it doesn't cost them any more to dose properly. And the patient feels a lot better. But there are also some cases where, say, if you do things right, it's going to cost some money in the short term. It'll, we think, save money in the long term because people are healthier. But if you get more people to get breast cancer screenings, those mammographies cost money. So in the short term, you're going to be spending more money. In the long term, that's going to get paid back. If you have a healthcare system where people stick with their insurance companies for a long time, either because they're insured by the government, like the VA or Medicare, or because, like in the old days when people worked for one company for all of their lives and they had, the company provided the insurance, like Ford used to do, the insurance company reaps the benefits of what happens in the long term. So the patient gets healthier and, down the road, the insurance company saves money. And so it's great for them to invest in all kinds of prevention. It's really hard when there's a lot of instability, people changing jobs. When they change jobs, they change insurance. Insurance companies don't have the same kind of structural incentives to optimize over the long term.
Right.